Thank you, Madam Speaker. I'm pleased to stand in the House today as a follow-up to my question on funding for a national framework for mental health. I would like to start today by sharing how mental health has impacted my journey here. I began my career as an educator. One day, a 14-year-old student got into some trouble in class and was sent down to see me. As we talked, it became clear that there was a lot going on. I was aware of some social struggles in their friend group, and I knew a bit of family history. Suddenly and unforgettably, this student, for whom I cared deeply, said the words, "I don't want to live anymore." They had the means and the motivation to escape their painful experience. The weight of their suffering hung thick in the air. I did what any human would do under the circumstances. I did my best to stumble through the rest of the conversation with empathy, but I recognized very acutely that my colleagues and I were not equipped to navigate the complexities of these conversations with the youth who trusted us the most. I would spend many hours and resources finding the tools to tackle this crisis, and I wish that many other Canadians would also have that opportunity. I am acutely aware of the pain of suicide, as many of us are. We have all lost someone, a cousin, the child of a teammate, a coworker, a friend, a grandmother. Research shows that approximately 90% of people who die by suicide suffer from mental illness or addiction. Suicide is the second leading cause of death among youth ages 15 to 24. Rates of suicide are 3 times higher for members of First Nation communities than they are for non-Indigenous people. Risk factors are directly linked to socioeconomic characteristics, including household income, employment status, level of education, and family support. I have shared a story. I have shared the data. Now I'd like to look to the solution. Canadian provinces and territories need financial support from the federal government to ensure that they can address the mental health crisis impacting families and communities across the nation. We need to invest in training for professionals across sectors, educators, and everyday Canadians to access resources and learning opportunities to support those suffering from mental illness. We need to invest in a timely diagnosis process. Service providers and families need access to early diagnosis to ensure early intervention. We need to invest in a national pharmacare system. Canadians should never have the financial anxiety of needing to choose between buying groceries or life-saving medications. We need to invest in support for sexual assault survivors. This is a massive missing link in this conversation. We need to invest in support for elders, like intergenerational housing, to avoid isolation and loneliness. That is why, on February 26th, I asked the Minister of Finance if the budget would include funding for a national framework on mental health, so that the provinces and territories can work together to find solutions to address this crisis. I look forward to hearing the response from the Honourable Member and to how we might come together to restore hope for Canadians across the country. Thank you.
The Honourable Parliamentary Secretary to the Minister of Women and Gender Equity and Rural Economic Development.
Thank you, Madam Speaker. I'd like to thank the member first and foremost for sharing her story and for providing the House with this opportunity to speak about mental health. According to Statistics Canada, 1 in 3 Canadians will be affected by a mental illness in their lifetime. Mental health is influenced by a number of factors, including life experience and social and economic conditions. Our government recognizes the need for a comprehensive approach to mental health, one that embraces promotion and prevention alongside treatment and recovery. For this reason, we have worked with our partners and stakeholders to put in place community-based programs and initiatives that promote mental health and contribute to the prevention of mental illness. Our government is also committed to increasing the availability of high-quality mental health service for all Canadians. Through Budget 2017, we provided provinces and territories with $5 billion over 10 years to improve access to mental health and addiction services. These targeted investments will address specific gaps in the availability of mental health services, including those for children and youth. Allow me to illustrate through concrete examples how these investments are expected to directly help Canadians suffering from mental illness. With this funding, in my province of Newfoundland and Labrador, we will add new community crisis houses to provide a safe place for people experiencing a mental health crisis. Several models will be explored for these beds based on the emerging needs of each of the province's regional health authorities. Quebec will improve accommodation and community retention services to provide psychiatric hospitalizations and reduce psychiatric ward stays. The Northwest Territories will contract an interim private consulting team that will provide surge capacity assistance to individuals struggling with mental illness through timely crisis supports when local resources are either unavailable or overwhelmed. Saskatchewan will establish residential options that include intensive supports for individuals with serious and persistent mental health issues. With federal funds, Ontario has committed to develop and provide new services in support units, such as daily living supports and case management for those living with mental illness and those with addictions and those who are at risk of becoming homeless. Federal investments will also support other initiatives in Ontario, as well as New Brunswick, Prince Edward Island, and Nova Scotia, that integrate mental health and addiction services into supporting housing programs, justice services, education settings, and they all will have a particular focus on youth. To provide support for these struggling with suicidal thoughts, our government is also investing close to $3 million over 5 years to support the development of the Canada Suicide Prevention Service through Crisis Services Canada. This service connects people in Canada to a confidential 24/7 crisis support and resources through trained responders. And finally, to provide child and youth mental health, our government is also investing $1.1 million in 2019-2020, and that's ramping up to $4.7 million in 2020-2021, and onwards to $4.9 million from 2021 to 22 and onwards, through the Mental Health Promotion Innovation Fund. The fund will support the development of new and promising interventions that aim to address the underlying determinants of mental health in children and young people throughout Canada. To sum up, Madam Speaker, mental health is a priority for this federal government, and we will continue to work with all our partners to make improvements in this area. Thank you, Madam Speaker.
The honourable member for Fredericton.
Thank you, Madam Speaker, and I thank the member for that really wonderful response. Lots of great initiatives taking place in Canada. I feel we've come a very long way. I do want to highlight there are still some missing pieces. Mental health has long been recognized as a fundamental aspect of one's health. However, under our current health regime, the majority of mental health services do not meet the eligibility requirement of medically necessary. So I feel we need to relook at this, and that's why I'm asking for a national legislation framework. There's a patchwork of provincial and regional initiatives that are occurring, but I feel we need a more unified approach. I'm thinking of a story of a constituent who is searching for their son across provincial lines, having a lot of difficulty because there's not a lot of collaboration and communication that occurs. So I'm really asking for a national strategy to be looked at and funded by this government. Thank you very much.
The Honourable Parliamentary Secretary.
Thank you, Madam Speaker. And I know my honourable colleague, is passionate about this, and I encourage her to work out and reach with all the departments at every time. And I'm sure she knows that most of the federal money that's given to the provinces, they determine where that goes. That's why we were so adamant in earmarking that money for mental health initiatives. But we are committed to a comprehensive approach to mental health, one that embraces promotion, prevention, treatment, and recovery. We're investing in a range of culturally appropriate mental health initiatives and programs that will take into account social, economic, and environmental factors such as income, housing, and education. We're also working with our provincial and territorial partners to improve access to mental health services for Canadians. As mentioned, through Budget 2017, with our commitment of $5 billion over 10 years, investments have been made in appropriate and cost-effective mental health services for Canadians, and will ensure that the provinces continue to do so. The challenge of addressing mental health issues requires the combined efforts of all levels of government and many stakeholders and all members in this House. Thank you, Madam Speaker.